Good afternoon, fellow viewers. I am Dr. Simpiwe Siko from the South African Military Health Services, and today we are going to be discussing patient advice on medical matters. It's questions that I've been receiving from some patients, and hopefully I will provide information that will be useful to some patients in the future. I would like to again welcome you to Dr. Siko's room. So, in the medical system, the patient has got a role to play in their journey to getting well. So I've broken it down into 4 points there. It's more complicated than that, but for simplicity's sake, I've broken it down. The patient has got a role to get early medical help. The patient has also got a role to get better. Thirdly, the patient has a role to return to normal functioning and to be reintegrated into society. So those are the roles of the patient. The medical framework is very complex and is very important for the patient to understand that the medical systems are complex. So they comprise of workup of what is wrong with the patient, a referral system that is there, which is also in its own highly complex. There is also an appointment system that should be strictly adhered to. There is also time periods. Time periods in the medical system are very important, and at most times we prefer that our patients stick to these time periods, not because we like asserting authority, because missing out time periods or not adhering time periods can result in numerous delays. So please let us do understand that the system is complex. Now, going to medical documents. Medical documents are very important to the medical system as a whole. It is very important that the patients do not discard medical documents after leaving any point of healthcare. And at every visit, this medical document should be brought along. Discharge documents, referral documents, previous procedures, identification documents, those are very important. And also authority documents that could be from health centers or from the medical aid. Now, medical history is very important. Everything that has happened to the patient up till that point in time, everything that is medical that the patient has had, it is the responsibility of the patient to own it. The patient must know their diagnosis. The patient needs to know their restrictions, and the patient needs to know the dates and time periods of events that have happened to them. Now, medications. Some pointers on medication. Take charge of your own medication as a patient. Medication names are very important for patients to know. They need to know why they are taking those medications, how many tablets or how many spoons they must take, and after how many hours in a day. Be compliant to your medication. Do not share medication with other patients, even if you think the condition is so simple and straightforward. A few don'ts. When consulting, do not give a diagnosis to any healthcare practitioner. Just tell them what is wrong with you. As a patient, it is important to not dictate medical management or dictate the treatment that you should get. It is also important that if you do not trust the doctor, rather go and seek healthcare somewhere else. Don't use probing questions to try and find the qualifications, and do not delay seeking medical attention. Now, absolute do's that I would advise our patients. The patient must ask for a discharge summary. The patient must ask for the diagnosis from their doctors. The patient should also ask for second opinion if they are not happy with what the care they've been getting. Follow the regular checkups and ask for your copy of the results. This is once again Dr. Siko's room. Please like, subscribe, and definitely share, and leave more questions or comments down below.